So we'll look at okay. We'll look at the biography of Charles Neer. So you can see that in brackets, every time they talk about this man, they always try to put up his title that in orthopedics today, he was one of the first person to actually push on a lot of studies regarding shoulder surgeries. Do you understand? So he was a shoulder surgery pioneer. His name is Charles Neer. Okay, Charles Neer. Okay, so let's quickly look at him. So his full name was Charles Sumner Neer. That's Neer 2. Was an MD. So he was born November 10th, 1917, and he died February 28th, 2011. Well, that was when I just stepped into high school. He was an American orthopedic surgeon. Alright, so he died on February 28th, 2011. Okay. So he was an American professional orthopedic surgeon, and he specialized in shoulder, okay, treatment of the shoulder. That's why you could see him with the, could be like the radius and ulnar, but going up you have the humerus and you have the shoulder. Okay, so you could say anything hand, right? So he specialized in somewhere doesn't mean he couldn't be able to do things in other places. Do you understand? So what's his career highlights? He was a long-time faculty member at the Columbia University Medical Center. He was a founder and first president of the American Shoulder and Elbow Surgeons. He developed the Neer prosthesis, which was actually one of the first practical and widely used shoulder replacement implants. He introduced the Neer's classification for proximal humeral fracture. So if you have a humeral fracture, for them to access how far the damage has gone, they usually go into that classification. So he has published a lot of things on all those articular replacement of the humeral head, classification of displaced proximal humeral fractures, then also the anterior acromioplasty for chronic impingement syndrome. That's where a nerve is actually compressed around the shoulder. So that's what we got. So contribution, he revolutionized anything shoulder surgeries. Established a lot of surgical techniques that helped in the treatment of impingement syndrome and residual cuff pathology. And he trained a lot of surgeons. Do you understand? A lot of them became very successful in orthopedics. So he was recognized as a pillar of orthopedic surgeon. He helped to actually take the practice further. His innovations laid the foundation for modern shoulder surgery, making him one of the most influential figures in orthopedic history. Okay, so he's remembered a lot as a mentor and also an educator. This tip out,